Okay, so the three types of paradoxes. There's resolvable ones, which are just easy to resolve when you look deeply into them. There's antinomies, which are harder to resolve because they have two valid points. And there's aporias, which are really hard to resolve, and in some cases, well, really, unresolvable because of the points that they produce are, well, they're really valid. So, resolvable paradoxes. How do we look at them? For example, when healthcare cures the disease, they are accused of creating another one. And a good example of this in modern day is coronavirus, and we've already had a vaccine being developed. But throughout its development until now, there's still conspiracy theories revolving around it and still being produced, such as Bill Gates will do this or China will do that. And here's the thing, medicine has come up with a cure or a treatment path for coronavirus, but people will still think that it will give you a disease. And why is this? Well, it's because of misunderstanding. They don't understand what's happening, and that's what resolvable paradoxes really revolve around. When it comes down to resolvable paradoxes, it's really rooted in the fact that people have high expectations for medicine, and they may even misunderstand what medicine can provide for them. An example of this is, for example, say a patient demands a certain kind of treatment because they want a certain kind of, they think it will help them in some way. But you can't give a patient a treatment that you know will be harmful to them, especially if they don't know what it's going to do to them. And that's also rooted with the fact that medicine is seen as a magic bullet. People have such high expectations of medicine, and doctors and healthcare professionals are now to the point where they are doing some of the best medical care in history, but they're so worn out, and people still have high expectations from them. Again, if a patient wants a certain kind of treatment or they expect to be treated in a certain way, they will not understand that, for example, a doctor can't do that to them, or that what they want is impossible. But this is all resolvable in just a doctor or a healthcare professional or a community project. All they have to do is just explain to the patient, to the population, what can be expected of healthcare professionals and what they can do. Antinomies are really ethical problems here. For example, a patient has a right to autonomy. If they want a certain kind of treatment and they have the capacity for consent, they can ask for it. But what they want may not always be what's best for them. So a patient's autonomy, and they have the capacity for consent, may say that they refuse the treatment, but the autonomy of the doctors and healthcare professionals, what they think is best for the doctor, will collide with this and go against it. And so we have a valid discussion of autonomy versus heteronomy, a patient decision versus what the healthcare professionals think is best for them. Another ethical problem here, and sort of philosophical one really, because again, antinomies are solved by philosophers, is, does a psychiatric medication that works on the soul of the body, does it actually solve the soul and the psyche? Antinomies are sort of related and intertwined with the discussion of is medicine an art or a science? And this is something I looked into in one of my previous videos, is medicine an art? What I mean by this is, for example, on one hand, the patient is everything. The patient is a singularity. They're the most important thing, especially to themselves. And a doctor can treat it that way. But on the other hand, you have the fact that there isn't just a singularity, there's a whole population, the collective. And so a doctor has to not just treat the patient, but the whole group. And so how does this collide? Well, a patient may want to be treated in a certain way, and art would dictate that this patient needs to be treated as they should be for their own needs and their own expectations. Give every patient a specific fine-tuned treatment for them. While science would say this patient has this kind of condition, and what the evidence says is that this kind of condition will be treated with this kind of medication and treatment. But healthcare, realizing that both of these are valid points, has come up with a solution, which is to combine them. And this is where personalized medicine comes in, where we have all the knowledge and we have all the research to say that this kind of treatment works for these kind of patients, but we give it to the needs of a specific patient and we see what works for them and what doesn't. So then we have art and science. But this doesn't always work, and this is where aporias come in, where the conflict is so strong that it becomes unresolvable. Aporias are rooted in the fact that doctors, healthcare professionals, patients, everyone's ideas, interests, and expectations of what is correct, what isn't, and what should be done differs. And it's also rooted in the fact that medicine can't solve everything and can't understand everything. For example, here's a combination of both. Fibromyalgia is a condition that can't be treated. And say a patient came in complaining of this kind of symptoms, and they requested these kind of treatments because they think that this is the condition that they had in the past and it's coming back, so they want this kind of treatment that got rid of it. But under further inspection, the doctor decides it's fibromyalgia, so they decide they can't give them any treatment because it could be harmful to them or because it's not something that would be useful to them. And so here we have the conflict of the fact that medicine can't cure everything, and we can't understand everything, so we can't give treatments to everything. And now I have the conflict of what the doctor wants and what they would. So for example, they're saying that, okay, you shouldn't get any treatment because you don't need it, versus what the interest of the patient, who thinks that they have this kind of treatment, they need this kind of treatment because they have this kind of condition. Aporias seem to be unresolvable. And what I mean by that is, unlike the other two, who have people who can resolve them, now what I mean by this is resolvable paradoxes are resolved by healthcare professionals and the community teams and even the patients and the population themselves. And Antipodes have philosophers and bioethics people resolving them. When it comes down to aporias, no one's really given the role or the task of resolving them. And why is this? Well, it's because it's a mix of both of the previous two paradoxes. No one really knows who should be resolving them. But the problem here is they're faced by doctors and healthcare professionals on a day-to-day basis. And in that case, they have to resolve them and face the consequences of them. But there is never really a true correct answer to aporias because, again, they are unresolvable. So I hope you enjoyed this episode of Medicinals. If you did, please leave a like, subscribe and a comment. I'll see you in the next one.